But first, let's go back a bit. Back to the early days of this last legislative session. A piece of legislation was near and dear to Governor Little, so much so he gave it a name, Leading Idaho. Well, this bill was signed into law back in February, and it basically was aimed at improving teacher health insurance by raising it to the same level as state employees. School districts celebrated the move at the time because what better way to attract and retain teachers than through improved benefits? However, as school leaders started to crunch the numbers, they realized maybe switching health insurance plans might not actually be the best option. Financially, it just doesn't make sense, they say. Joe Pear spoke with school leaders about the math and the plan moving forward.
Coming out of the Idaho legislative session, Governor Brad Little and Idaho lawmakers touted legislation that aimed to improve health insurance for K-12 employees. The idea, get eligible public school employees on the same level of health insurance as state employees. House Bill 443 was celebrated when it was signed into law, but as school districts are doing the math on costs, some are finding that the program might not work for their district.
We're still kind of looking to see exactly what we want to do with that.
Randy Dewey is Director of Finance for the Nampa School District. Like other school district finance heads, Dewey is doing the math on what the cost of the new program would be compared to the current health insurance that Nampa Schools has. Based on new funding numbers from state and federal funds, Dewey says it appears that Nampa would still need about $1 million in one-time costs to join the program, in addition to about $600,000 to $800,000 annually to maintain the insurance program. Dewey says right now the task is working through the numbers and options to find enough money to make the jump.
Right now, just trying to do the math. We're just barely into in our budget world, the legislature, throwing us curveballs here and there. We're trying to work through that. But other than that, it's really once we finalize revenues, make sure we're good there, and finalize expenses, we can kind of go back and say, is this something we want to do or not?
Nampa is not alone in figuring out the financial future. A spokesperson for the Kuna School District tells me that the district's insurance committee and negotiations team researched joining the state plan based on these new funds. They tell me in a statement, quote, the committee's research showed that the cost to switch over would exceed the new money available. Kuna is set to get $1.1 million from the newly signed bill, based on the number of state-funded positions the district has. It will be a different allocation based on staffing levels for each school. A spokesperson for Kuna says, while the $1.1 million won't fund a shift to the state's plan, it will help improve our health insurance plan. We've surveyed our employees about what improvements they'd like to see, and our negotiations team and insurance committee are working on it. It should be finalized later this spring. The district adds that they are appreciative of the bill's sponsor, Representative Furness, going out to Kuna to answer questions about the plan before it did become law. They say that Representative Furness identified a possible fix should he return to the legislature next year. Now, to be clear, districts who don't move to the state plan, they still get funds to lower insurance costs for their employees.
Super ecstatic that they gave us this money. It's even if we don't go in the state plan, we're going to use it towards all of it's going to go towards insurance. So we'll either bring it down our own plan or we're going to try to go to this plan.
Dewey says the goal is to join the state plan, but the math of it all will ultimately decide if the district can afford it.
It's an amazing amount of money that the legislators and the governor has put towards this, and it is fantastic for all of our employees, not just our teachers. And we're super excited to have it. It's just now what we don't want to do is put ourselves in jeopardy of not being able to pay for it in the future, because once we go in, we're kind of obligated at that time.
I know, Joe, when we first started talking about this bill, when it was first introduced and then signed into law, it seemed like everybody's for it. But as you said, they don't have to join this. But why does the math not add up?
So school districts and schools, they'll have certain employees, some that are fully funded by the state. They have these state units, so to speak, where based on a funding formula, the state of Idaho will send a certain amount of money to a school district and say, this money is for you to pay the employees we have allocated money for. Now, if a school district finds that they need an extra support staff or maybe a few more staffers, they can use federal dollars or bonds and levies to hire all kinds of different employees, whether it be a teacher or support staff, whatever. Those funds, though, that are not from the state state, the federal funds or the schools and levies, because they're paid for that in a different way, this program did not account for those employees. So, Brian, what really school districts have to do is make up for those employees that are not fully funded. Again, though, I just want to reiterate, this program that is signed into law, each teacher will get about $4,100 more. I should say employees should have $4,100 more. So they are going to get money to help their insurance either way.
It just depends on the district on what money is available and where it's being spent.
Yeah, different employee makeups in different school districts.
All right. Thank you very much, Joe.